Hello, my name is Lachey, and today I'm going to demonstrate how to administer a transdermal and topical medication. We're going to always start with performing hand hygiene. I'm going to check the MAR to make sure that this is the correct client, also the correct medication, and the correct dose. Okay, so I did my first check, and I have the medication here, which is called Transdermal. I'm going to bring the medication to the client's room.
Yes.
Hello, can I have you verify your name and date of birth, please?
My name is Max Smith, May 1st, 1989.
Max? Okay, thank you. Can you verify any allergies that you may have?
I have latex allergy.
Latex, okay. And I can also validate that information by looking at her MAR. Okay, Max, so I have here your Aspercreme and your Nitroderm. Okay, I'm going to perform hand hygiene again. And I'm going to apply non-latex gloves because my client has latex allergies. And I'm also going to assess for her vitals before we administer the medication, because sometimes vitals may indicate the need to administer or not administer a medication. In this case, her vitals are fine, her labs are fine, so she can now receive her Nitroderm and her Aspercreme. The Aspercreme will go in a cup. And I have her Nitroderm that I'm going to date the time, the date, and my initials. All right, so we will apply the Aspercreme where it shows here on her right elbow. Okay, and then we are going to give her Nitroderm patch. Now, before giving her this patch, we want to make sure that we take off the last patch. And it shows on the MAR that her last patch was located on her left shoulder. So we will make sure that we take that one off first. Okay, we'll put it in the right disposal cartridge so we can give it back to whichever place is necessary. And now we're going to place the new one on her right shoulder. And I've already time, dated, and stamped this thing. Okay. Now that her patch is on and her Aspercreme has been given, we are going to document that we administered that medication and check it off. And then perform hand hygiene. Okay, in this video, I'm going to demonstrate the administration of ear and optic medications. Before we begin, I want to make sure that I assess the patient's ear and eye. Hello, I'm going to perform hand hygiene, put on my gloves. I'm going to assess the patient's eye and ear. Everything checks out and the patient is now ready for their medication. I'm going to go into the MAR and make sure that this is the right medication by matching it to the MAR. Okay, and I'm going to check the dose, which is 1 drop per affected eye. I'm going to check the route, and this checks out. For the ear medication, I'm going to do the same thing. I'm also going to assess if there are any contraindications as to why I would not administer this medication. Now that everything is prepared, I can go back to the client's room.
Yes.
Hello, can I have you verify your name and date of birth?
Max Smith, May 1st, 1989.
Thank you. I'm going to perform hand hygiene. And now I'm going to don my gloves. So So before administering the eye medications, I want to make sure that I have a napkin ready and available for the patient, so that way we can catch any excess fluids. I'm going to open up this, placing the lid this way. I'm going to have the client slightly tilt her head back. I'm going to hold the conjunctiva sac down. Okay. And I will administer 1 drop, having you hold. Okay. Now that the drop is in, we'll wipe in any excess fluids, but not too hard and not putting a lot of pressure on that eye. Okay. Now that, and also when we're giving this medication, we want to make sure that we do not touch the client's eye, especially if it's infected with something, because it will cause the tip of the dripper to become contaminated. As for ear medications, we want to have the client lay in a lateral position. So I'm going to get you turned on your side. Okay. And for an adult, we're going to pull the pinna up and back. And then we're just going to place it, instead of placing this directly into the middle of the ear, what we want to do is place it on the top part to allow the medication to drip down into the ear. We're going to have the client lay on the side for about 5 to 10 minutes. At this point, we will then administer a cotton ball in the client's ear. We're going to document that this medication has been given. Okay. We're going to perform hand hygiene. And we also would have lowered the bed and made sure that the patient's call light was within reach. After that, I'm also going to come back in about 30 to 45 minutes to reassess the patient's condition. And I've documented, I've washed my hands, and that will be the end of this video.